So there are three models that I will share here. One is an authoritarian model. This authoritarian model is actually probably one of the oldest model of doctor-patient relationship. Here, the model is based on something like father and the child relationship. The notion is that the father, i.e. the doctor, knows the best, and he can decide on behalf of the child, i.e. the patient. Here, the doctor's role is gather information and recommend the treatment, and there is no real concerted effort in this joint decision making or a discussion. Now, in many countries or many cultural situations, many societies, this is the prevailing model of doctor-patient relationship, and here we'll go in slightly greater detail and to understand the pros and cons of this model of relationship. Now, the argument against this authoritarian model is that it's actually erodes the underlying value of patient autonomy. Decision is fundamentally made by the doctor, not necessarily reflect the best interest of the patient. It does not take into account a patient's own value system. And the patient, as we know, the patient's own understanding of what is best for him or her can be vastly different from our understanding of what is best or best for him or her. And it doesn't actually take into account of social, religious, cultural, financial, familial value. And we tend to inject own value system into the decision-making process, which actually lacks objectivity and shared decision-making. However, there are some arguments about this authoritarian model of decision-making. It emphasizes the principles of beneficence, doing good, and avoiding harm by the physician. And actually, this model may be applicable or may be more palatable to a patient or the family in a certain situation, such as in acute care setting, the patient is in severe pain, and then doctor recommends a particular treatment, and there's essentially the patient have very minimum alternatives, and he decides on the pain relief. Or in a situation where there is an acute need of blood transfusion, and the doctor recommends a transfusion or fluid infusion, and there is a very little alternative for that patient, and the authoritarian model of decision making seems to be the way to go in those kind of acute urgent situation.